Okay, Sculptra is being replaced. You never thought you would hear that from me, but you are today. And you hear it from the stars. Look at all the kickback that they're saying about Botox fillers and swearing off plastic surgery. Think Christy Brinkley. Think Drew Barrymore. Think Pamela Anderson. Even the Kardashians at times have said, no more Botox, I just didn't look like myself. We hear it all the time. We're moving to all natural. In the video today, I'm going to tell you what is replacing Sculptra. I'm also going to show you injections near the end of the video. You're going to want to watch this one because biostimulators are the most natural solution to looking like yourself but younger. Do this, not that. Today I'm talking about 3 places I never put Sculptra, but I'm not going to give you a problem without a solution. Many people don't want fillers. Many people don't want the bloated look. They don't want water drawing in. They don't want traditional hyaluronic acid fillers because it can make them have a pillow face or make them look unusual. A lot of people turn to what we call biostimulators. 2 common ones are Sculptra. More and more people are doing Sculptra because now it can be trained on, you can dilute it immediately, and there's new things coming down the pike. So, you don't put Sculptra in certain areas just like you don't do certain treatments at all or in certain areas because it won't work or it will damage the skin. What are those 3 areas? If you like the videos, click like and subscribe. Try to bring you information that helps you save money, time, and effort and look beautiful, healthy, and vibrant. Number 1, I've never put it under the eyes. So Sculptra is polyl-lactic acid. You mix it up now immediately. It has little beads. They're about 60 microns in size. And you shake the syringe a little bit so it's a uniform solution and you inject it. There's too much stimulation to do it underneath the eyes, and the eye tissue is thin and the risk of nodules is very high. It's not dissolvable, so I don't recommend doing that. And let's say you have a 7% risk of nodules. Maybe people say, well, 7% isn't high, but guess what? You'll see 100 people in a week, no problem. That's 7 people in a week. That's a lot. So that's the first area I don't use Sculptra. Number 2, so around the eyes, around the mouth. 2 concentric areas where the muscle contracts and moves inward. The nodules are created by clumping of products, not granuloma like most people think. So around the mouth, in the lips, never use Sculptra. And the next area is the neck. As you might know, the neck has a strong muscle. It holds the head up. It's called the platysma. It gives you those terrible bands that everyone likes to Botox or surgically remove. And so that muscle can move the products and clump it together, and the skin is very thin. So any little lump or bump, you'll see it. So that's the 3rd area I don't use it. What's the solution to that area? Now, people don't want fillers. They don't want the pillow look like I mentioned. They don't want to look unusual. They're trying to avoid them, and they go for those biostimulators. Is there a biostimulator that could replace Sculptra in those areas? And it's not even a matter of replacing it because most of us have never put it in those areas for about 10 years. Prior to 10 years ago, we did use it in those areas, and that's how we learned. Medicine is the practice of medicine, and what that means is we're always looking for best practices based on the outcomes of our patients, but there are going to be injection techniques. I was going to use the word drugs because just like the drugs you take orally that we find out aren't the best to be on in the way we give them. And with fillers, as we learn more, we alter our techniques to get better outcomes, and that's not putting it in these 3 places is what we've done for the past 10 years. And you want a biostimulator, you don't want a filler. I use all natural Easy Gel, and I'll tell you what that is and how I use it. And I'll tell you how to use it in the neck, how I use it in the neck, because we want to add another biostimulator for the neck, and that is calcium hydroxylapatite. If you want to. It's not a necessity, but those that want even more biostimulation safely in the neck. So, under the eyes, around the mouth, in the lips, you can use your own blood product. You spin it down, you get your growth factors. That's a liquid. You spin another portion down, you get the albumin from the blood, you heat it up, it makes a gel, you put your they're in a cooler. After you spin the blood, you put the growth factors in a cooler. cool growth factors with your heated PRF gel, mix them back and forth, and now you have active growth factors, stem cells, and signals that tell the body to make the fat better, because that's what happens in the face, the facial fat. As we age, it sags a little bit. We lose some fat. The fat's not plump. The lymphatics are poor. And we make that more healthy by signaling through those growth factors. And if you're a growth factor nut and you like to study this stuff, think vascular endothelial growth factor. That's a big one. Actually, it's huge. You could study that one all day long. Fibroblast growth factor is another one. Transforming growth factor. There's 3 off the top of my head. That could be a whole career studying what they do. But they essentially help new collagen, elastin grow. So that's an all natural. There's no synthetics in PRF gel. Easy Gel is the one I use. And you can put that back in those areas where we do not use Sculptra. And if you do not want fillers because you do not want that untoward look that they can give, and maybe you just don't want anything synthetic in your face, on the neck, you can put your PRF back. And I said, I'll tell you what else you do. I mix it in a specific ratio with Radius, which is calcium hydroxyl apatite. And I teach that, of course, on my aesthetictrainingcenter.com. And it's known, people know how to do this, but I like to teach it because the neck is very difficult for all of us to treat. And it's why people with RF microneedling always talk about, hey, I got fat loss. I'm trying to get a non-surgical neck lift, Ulthera. They're trying to do all these things, but sometimes you just need biostimulation, collagen stimulation, unless you need the other part of it, which is fat removed. And that's a whole other topic. I have many videos on that. So those are 3 areas I don't use Sculptra. There's a solution for it. It's what I do in my practice. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.